My name is Tom. I'm a nurse at Visiting Nurse Association of Ohio. Last year in our county, just under 600 people died of opiate overdoses. That was more than the combined total of deaths by motor vehicle accidents and by homicide. And the number was twice the number of people that had died by opiate overdoses the year before. These are not nameless, faceless addicts dying in an alleyway in downtown Cleveland. These are our friends, our neighbors, our coworkers, and our relatives.
My name's Frankie, and I'm a drug addict. I first smoked weed at 13. It progressed to alcohol and then pharmaceutical drugs. I broke my hand and was prescribed Percocets. And then when the script stopped, I was addicted and didn't even realize it. I started using heroin because they cut down on pills and you couldn't get pills no more and they were so expensive. So I started doing heroin and crack cocaine.
I'm William. I've been addicted to heroin going on 3 years now. Prior to that, I've done a whole panel of drugs: cocaine, alcohol, marijuana.
The Ambulatory Withdrawal Management Program offers comfort medications to clients who have just completed a 5-day detox program and are going to a residential treatment facility, which historically has not offered them medication.
This detox was a big help, took the edge off. I came down here to Stella Maris and could not sleep. I was getting delusional. I wanted to leave. I was bad. And you guys came to see me. And then you guys prescribed me some meds. And it took the edge off. And it didn't work the first night, but the second night, I finally got some sleep.
Consequently, as the symptoms of withdrawal continue past detox, craving, cramping, muscle pain, and diarrhea, patients just leave the facility to go use because they know they can feel better in minutes, and since their brains are still sick, this can be an almost automatic response. Our goal is to offer them medications which will help them relax, help them focus, and stay in treatment.
They started me on this regimen and it helped me get through some of the early days are the hardest, I think, to get your head clear and the physical withdrawal out. It got me through to the point to where I was able to learn. In the beginning, your brain's really cloudy, your emotions are coming back. It's really difficult to absorb any type of information. And I was able to actually listen and gain some information on this disease of addiction.
Our detox provides a 6-day detox. Sometimes a detox takes a little longer depending on what they're withdrawing from. That is the biggest period of where we find relapse happening. You're taking a substance away from an individual that has relied on it. There's no coping skills that are developed within that short amount of time.
Our plan is to offer them medication that will allow them to relax, focus, and stay in treatment. We have a very limited formulary: gabapentin, Vistaril, clonidine, naltrexone, and doxepin. And I assure them that while they may not feel good, they will absolutely feel better. And because of our relationship with a local pharmacy, I can guarantee the client that the medication will be there tonight. And I think this is a very valuable tool to be able to say to somebody, just hang in there for a little bit and you will absolutely feel better tonight. Our program focuses on withdrawal management support, so any medication we order would only be for 2 to 4 weeks. What makes our program unique is that we also have a social worker that will work with the client, an adjunct to the treatment facility programming, to see what the VNA can do to assist the client to eliminate barriers to extended sobriety. We know this is a public health crisis, and the VNA of Ohio is proud to partner with the Adams Ward of Cuyahoga County in a system-wide plan whose simple goal is to keep the person in treatment and keep the person alive.
That and the way they weaned me off them worked out perfectly, because within 30 days I was off all medications and I'm happy. I work a 12-step program. I don't know how it works, but I just keep doing what they tell me to do. And each day gets better and I get happier each day.